I have been summoned. Let's take a look at a video. All right, so are any of these real or is this pseudoscience? Let's take a look at each. First up, essential oils. A lot of people are surprised to learn that there is research backing the idea that essential oils can help with anxiety and depression, and this includes in animal studies, where, for example, an animal will become more relaxed when exposed to particular essential oils. Now, importantly, a lot of people think that just because you're smelling a nice aroma, that it's not doing something biochemical, and that's just not true. More recent research in the last few years has started to identify which specific compounds within essential oils seem to be having those psychoactive effects and demonstrating that those effects seem to be very similar to the effects of pharmacological agents you might get as a prescription from your doctor. And there's also an issue about the lack of regulation of essential oils when compared to pharmaceuticals. Now, that said, the side effect profile is generally much lower, if not existent, as long as you don't end up with, let's say, a bad batch or something you're allergic to, but it is something to keep in mind. Next up, light therapy. Huge proponent of light therapy, especially for folks who have seasonal affective disorder, where your mood is greatly impacted by the environment around you. Right now in these winter months, a lot of people get very down due to the lack of light, and a light box can be very helpful. Importantly, though, the effects are very specific. You really do need a particular intensity and wavelength of light for this to work, and that's why these light boxes are very special, specific contraptions, and not the same as like turning on a desk lamp, which clinically has not been shown to have that same effect. Last up, 5-hydroxytryptophan. This is actually a precursor of serotonin, so when you're taking it, you are effectively putting into your body one of the amino acids that your body will turn into serotonin. Same issues as the essential oils, though. It's an unregulated industry. You want to be careful what you're putting into your body, and you should let your doctor know if you're taking one of these, because if you take another serotonergic medication while you're on 5-HTP, they can interact and even create a syndrome called serotonin syndrome that can be very uncomfortable, if not harmful. So yeah, all three of these can work. They can have fewer side effects than many pharmacological agents, but for some people they are not sufficient, and we don't want to vilify the taking of medication when it is helpful any more than we want to vilify real alternative medicine that can work.